And welcome back to Talk of Alabama. If you suffer from chronic joint pain, well, it may be time to consider a total joint replacement. Now, I recently sat down with Dr. Daryl Dykes from the Alabama Bone and Joint Clinic to learn more about the procedure and what you can expect. Let's take a look. What is the pain or the recovery like for a replacement?
With our newer techniques with the blocks that we're using on the total joint patients is much better. We're using a variety of blocks at the time of the surgery to block their pain reception after the surgery, making it much more tolerable. We're also using multimodal pain techniques where we're using medicines to help block some of that pain response as well.
And what about things to consider, you know, the kind of the pro and the con list before we think about this?
Well, anytime you're hurting to the point that you would consider a total joint, usually try the non-surgical techniques first, using injections, medicine, therapy, weight loss, that sort of thing, to try to alleviate the pain and try to buy the patient a little more time. But if those techniques do not work and they are still functionally limited by their joint, then that's when we start talking about doing a replacement.
So they've got a lot of pain prior, then they do the surgery and they recover from the surgery. What can they expect from that point moving on? Do they have more mobility again? Do they feel like, are they pain-free at that point after the recovery?
After the recovery, most patients have very good response to the total joints. We try to get them back into their life, get them back to doing the activities that they like to do, short of running and jumping. We usually don't want them doing that sort of thing, but other than that, we try to get them back to their standard lifestyle.
And when you talk about full replacement, would that be in certain areas of the body or only?
Most of my practice involves shoulder, hip, and knee replacements. And those are the most common joints that are replaced. The replacements that we use usually involve metal and plastic implants that resurface the joints so that they can regain motion, strength, and function in the joint.
In the joint itself. Okay. If people want to learn more about this, or they've still got questions, how do they do so?
Well, certainly our website at our office has information on this. There are also thousands of websites on the internet that go into grand detail of how you replace the joints. There are also videos available on the internet that where patients can get a little more educated on the topic.
And in closing, if somebody's thinking, oh, I really do need this, but I'm afraid to have surgery, what would you say?
I would say be afraid of not having the surgery, because so many of my patients have gotten to the point that their quality of life is terrible. And they have talked to their family members, oh, don't do it. But I would encourage them to come to the office, allow us to talk to them, explain the situation, and I think they would be pleasantly surprised that it's not as bad as they think. And we'll get them through the process and get them back to living a good life.
The medical technology these days is impressive.
It has markedly improved just in my 20 years doing this.
Okay, again, the website, the phone number at the bottom of your screen. So if you're considering this or you've got a loved one considering it, why not go talk to the doctor and at least flush out the idea one way or another. And nobody wants to live with pain. So surgery may be a good or the best option for you. Thank you so much, doctor, for being